right, if you're just joining us, of course, this is Rise and Shine, and we've had a plethora of some major conversations this morning. But very quickly, something very also important. Our focus conversation this morning has to do with the International Day Against Drug Trafficking and illicit drugs as well. That day is being celebrated on the 26th of June, but we just decided to start creating the awareness from today. And for the media, it's not about just celebrating these days when we call for international, celebration. It goes beyond that. We need to keep talking about these issues. We need to keep enlightening people. We need to keep pushing for advocacies and all of that. And of course, we see that the theme for this year is Stop Stigma and Discrimination, Strengthen Prevention. Okay, so prevention motives now is very, very important. But joining us on set this morning is Aweda Matthew. He is the Deputy State Commander, NDLEA. Good morning, sir, and many thanks for joining us.
Good morning. Thank you very much.
And then, of course, we also have Barrister Clifford Thomas, who is the State Coordinator, Legal Advocacy, Response to Drug Initiative. Thank you so much, Barrister, for being here. Now,
good morning.
I see you as a man of different capacities, or many capacities now. It's surprising that you're also here to be talking about illicit drug trafficking,
well,
Barrister.
We have to be here because we are all potential victims.
Yes.
And we must work with the NDLEA, the organization saddled with this responsibility. We can't leave it to them. How many are they in that service? So it's a fight for more than 200 million Nigerians.
True.
So we must rise up, support NDLEA, and ensure that we achieve this objective. So I am everywhere.
It's good to know. Now, let me talk to Aweda Matthew, or Deputy State Commander, NDLEA. I know that it's quite an uphill task that you people are doing, but let's know, how has it been so far fighting people that are into illicit drug trafficking in Akwa Ibom State?
Thank you very much. Thank you for appreciating the effort of NDLEA. NDLEA is fighting for the generality of Akwa Ibomite and Nigeria as a whole, in order to get rid of drugs in our society, because this thing has eaten deep into the society and people are suffering it. A lot of people have fallen victim of these drugs, while some people that you think may know better, they are trying to play ostrich, and it's affecting the society. But NDLEA, this is the job we signed for, and by God's grace, having people supporting us, we are going to achieve it.
Okay, now before I even talk about organizations like the one Barrister Clifford is coming under, I want to know what's the synergy like with government in terms of this fight against illicit drug trafficking in the states.
Thank you very much. NDLEA is an agency created by the federal government, and we have our officers working in different formations, and that is why we are here in Akwa Ibom. In Akwa Ibom, we have our officers in the 3 senatorial districts in local governments. We have our area command in Horon, we have area commands in Naked, we have Ikotekpene, we have in Ikotabasi, we have people in Marine Unit. We are fighting this drug war from different angles. It depends on where our attention is needed. And in doing this, I need to appreciate the efforts of individuals, once again, the effort of NGOs, the stakeholders. These stakeholders, who are they? We are talking of our traditional rulers, religious leaders, the teachers, the students, parents. These people have a role to play. Ministries are playing big roles. Is it Ministry of Health? Is it Ministry of Justice? we are working together to ensure that we get rid of drugs in our society.
It's very, very important. Now, before we even begin to talk about what kinds of drugs that we will be saying, we will be calling illicit drugs, because coming from, the industry back in Cross River State, Calabar, when we hear of things that young people do for drugs, it's really baffling. But let me talk to Barrister Clifford Thomas. What is the role of civic society organizations, or civic society organizations in all of this fight against drug abuse and illicit trafficking?
Well, society is structured into three. You have government, you have business, you have civil society. And where government may not want to touch on, civil society is pervasive everywhere and wants to talk about it. So civil society is actually working in tandem with the government. And unfortunately, there is this misconception about civil society that is actually against government. We're not. We're actually working, like the collaboration we have with NDLA starts from where we need to understand ourselves. And then we take some messages out to the public. So civil society is actually doing its role to complement the effort of government. But we want to advise government and governmental agencies to work more with civil society. For instance, in the NDLEA, they have a retinue of NGOs that are registered with the NDLEA.
Okay.
Once you are registered, they vet you. They ensure that you are not even coming to promote the usage of drugs or whatever. And then they collaborate with you. They encourage you to be their eyes, to be their legs, to do the talking, where they just send one person. And then you gather like 300, 400, 500 people and talk to them. So they build our capacities in civil society to be able to relate with them. So civil society
with the right information.
With the right information. Civil society organizations across Nigeria are busy working in different spectra of life. Some on agriculture, some on crime, some on education, some on health. But those who aggregate themselves to say we're working on the issue of illicit drug trafficking, and we are trained by the United Nations Office on Drug and Crime. And we are giving the best practice globally, global best practice. And we come back to work in synergy with the NDLA because they are the mother body in Nigeria.
Sure.
Yes, so there's a high level of cooperation between civil society and the drug war.
Okay, back to Commander, sir. When we talk about abuse of drugs, a lot of people might think we're talking about, overdose of paracetamol or Panadol. So let's put things in the right perspective now. What drugs are we looking at? What is these drugs that we are talking about, and 10 people misuse of drugs and all of that? Let's know.
There is difference between drug abuse and drug misuse. When you are talking of drug abuse, these are drugs that are illegal that people are taking. And among them again, we have some of these drugs that are approved, but people are using it as against prescription. Now, when we are talking of drug abuse, hard drugs in the country, we are talking of class A drugs that has to do with cocaine, heroin, amphetamine. Now,
the one in eastern Nigeria, the Mkurumili, what's that one?
Let me correct it now. It is not only in eastern Nigeria. Mkurumili is in everybody's doorstep now. It's all over the country. It's hard drugs that affect the central nervous system. Apart from the fact that this thing can easily make somebody go mad, the end result of the whole thing is death. And they are seriously producing this drug that you mentioned locally. No wonder we have clandestine laboratories everywhere. And this kind of laboratory is not the one that you will know in time. It is only people that have serious knowledge of it that we know that something is going on here. Before you realize what is happening, they are producing drugs there. And this thing is seriously affecting in such a way that even if you are not taking, if you are not buying, living in an environment where they are producing emporumiri, you may be a beneficiary and it may affect you negatively. It is not environmental friendly. In fact, drug is problem to this country. No wonder why the chairman of NDLEA, Brigadier General Obamarwa, is seriously fighting the war left and right. We first need to understand where we find ourselves before the thing will affect us beyond repair.
When we say affect us beyond repair, for me, I think it has even gone beyond repairs. But it's quite appalling to see that the more we talk about this, I follow the spokesperson for NDLEA on Instagram, and I see that almost every other day there are videos of people that have been caught trying to traffic drugs. The more we talk about these things, the more it continues unabated. What seems to be the problem here?
A lot of factors. A lot of factors. You see, drug is a means of generating wealth for some people. This is a business you put little into, and overnight you turn to a millionaire. And these people will like to continue repaying you of money, destroying others to get their own wealth. But some ignorantly, because they want to be high, they indulge in it. Thereby the things get spreading. Another way is the contribution of social media. In Nigeria, some people are ready to hype unnecessary things, and from there they've imbibed the culture of taking drugs. A lot of factors.
Okay, Barrister Clifford, now, civil society organizations, you have been trained, and the objective of us even having this conversation is to try to see how we can begin to change the mindset of young people. Back then in Calabar, we heard that young boys would even sniff as dirty as the Sockaway. They will sniff what's that now, bond.
Solution.
Yes, and all of that. A lot of very funny substances just to get high. Now the idea is, let us begin to see how we can begin to change the perspective, behavioral pattern, mentality of young people from taking drugs. What do you think is a solution to all of this now?
Well, I want to dovetail into what the commander said. Social media, where we begin to celebrate the drug culture, the crime culture, the cult culture. Boys bring out music where they celebrate this thing. They flaunt wealth unnecessarily. And people believe that once you get involved with this, you get wealth. Wealth is not suddenly gotten. It is built from the bottom. We must change the mentality of this sudden wealth syndrome. And I blame our politicians also, because you get into political office, public office, and all of a sudden overnight you buy cars, you spread cars, you keep concubines and slave queens here and there. And the young men, in fact, some of them choose to drop out of school just to follow this culture, knowing that once you do this, you make money. So we need to advise ourselves from the churches, the mosques, the religious institutions, traditional institutions. We must go back to the basics. There must be moral instruction back in schools again. We must go back and look at what do we need to do, where did we get it wrong. So we must rise up from there and then spread. Churches are civil society organizations. Mosques are also civil society organizations. So we must go around and talk to ourselves and then go into our schools. Because if you reorientate our people from the primary, the nursery, primary, secondary schools and tertiary institutions, there will be some degree of reorientation. Behavioral change will become more positive. I want to use this opportunity to also thank the NDLA, not because they are here, but I know that they have been doing these counseling services where they treat these guys like virus, bring in the strongest strain of somebody who is on addiction or involved, exposed to drugs. Then you treat that person, reintroduce that same person back to the society, and the person becomes a lead speaker against drug abuse, against getting involved in this drug thing. But the politicians want to recruit boys and give them Indian hemp. Want to recruit boys and give them
they can use them as weapons,
yes.
you know,
they deploy them
weapons.
as weapons against their prospective enemies.
Okay, so another very interesting angle we need to talk about very quickly, as our time is almost wrapping up now.
Okay.
I know that Barrister tried to introduce that now. Stigmatization. There are people that, you know, have gone into drugs and, you know, they want to come out of it and all of that, and they cannot come out of it because maybe they get to suffer one illness or the other, and they go to the hospital, they are stigmatized for one reason or the other. How do we begin to help those people now, away from even helping them to get medical treatments and all of that? How do we even integrate them back into society?
Yes, like the theme for this year, People's First, to do away with stigmatization and to ensure that prevention is strengthened. Thank God in Akwa Ibom State, we have a mother as our leader, in person of Mrs. Basi Obot. The commander is trying to show that motherly love for everyone. We are having a counseling unit in our office nationwide, but the one here is strengthened. We have another mother heading that unit, our PSO there. In our office, we do see these people as one of us. We don't stigmatize them. There is no need of keeping them, giving them bad names. We've realized that these people, they have problem. Let us join hands to solve the problem. As if your son or your daughter is having problem, what will you do? Now, they are here having the belief that with you, they can get solution. So we are trying our office to ensure that we cancel these people, we rehabilitate them. And I want to mention the effort of the former First Lady in the state. The woman, as a mother, gave the state, not NDLA this time around, gave the state a rehabilitation center. It's for the state. I just pray that Akwa Ibomite may know how to make use of that rehabilitation.
But do people come out? Do people come out openly now to say that, okay, this is what I am going through, I need help?
Yes, people are coming out. People are coming out, and parents are coming out. We can continue to play ostrich. Let people know what exactly is your problem. We will treat you as one of us, and we will reintegrate you back to society.
Let me talk to Barrister Clifford. We've had conversations where some medical experts are saying that, look, let us begin to see drug addicts as it's an ailment rather than a crime.
Yeah.
Do we agree with that?
Well, partially, yes. The global trend right now by the UNODC and other lead organizations in the fight against drug is that you see the addict as a victim. And we are looking at harms reduction, HARMS. Harms reduction. It's in the national plan of the NDLA. But we are the Legal Advocacy Response to Drug Initiative, as lawyers who are actually out to help drug arrestees, talk to them, plead their cases, and do everything we can to help them. We are all in all around Nigeria, in all the states of the country.
But is that not a subtle way of telling people, oh, you can go ahead and do
No,
drugs,
it's not. It's
and
not
then come, we are going to embrace you back and reintegrate you back into society?
The NDLEA is still, it's called the National Drug Law Enforcement Agency.
True.
And I cannot arrest you and prosecute you. But once the NDLEA comes, they arrest you. If your case is redeemable, they bring you in, counsel you, and change you. But if it is irredeemable, they have the instruments. They go to court, and the law says minimum 15 years. So for those who are, in fact, let me bring out the harsh part of NDLEA.
Okay.
They arrest you for drug offenses, and since you are irredeemably bad and you cannot be rehabilitated, they send, if you are particularly a baron who is selling to destroy lives everywhere, they arraign you before the court. And the courts are very strict when it comes to drug offenses. And they send you to prison.
Yeah, true. Because when we even look at some crimes outside this country,
Yes.
the penalty for drug issues, trafficking, is even death.
Oh, well, in Nigeria, we have laws against all this, but we are at the mercy of judiciary. It's very, very discretional. A situation whereby the law is saying
This is the penalty.
once you go for 15 to 25 years, judge may decide to even overfine. And these are people, money bags, that their people are waiting. Even inside the court, the moment they pronounce the judgment, if it goes the way of paying fine, they will start shouting hallelujah, in the sense that they have the money there to settle. Forgetting that NDLEA officers, they've taken risk, because we do face risk. We do pay supreme price in the process of fighting drug war. Though humanitarian work, but a lot of officers have paid for this.
Even with their lives.
With their life. So we are appealing. It requires collective effort. And I believe people are trying to view things from different angles. Because we are fighting this war from different facets. Everybody must play his own roles. And I must appreciate what you are doing here. Sensitizing people. After sensitizing people, what are the judiciary doing? The schools, what are they doing? Don't forget, in primary schools these days, we have people that are taking drugs.
Sure.
Okay, what is this our community doing?
So it's more like all hands should be on
must
deck,
be on deck
to make sure that we cleanse our
People
society.
must be ready to ensure that we get rid of drugs in our society.
Very well spoken, Dan. We have just barely 2 minutes for us to leave set.
Oh, sorry.
But let me ask, 26th of June is the International Day to, talk about drugs and illicit drug trafficking. Now, what are the events that we are going to be seeing being rolled out in Akwa Ibom State to sensitize people more on the need to stop drug abuse?
Thank you. June 26 is grand finale. The program has started nationwide on the 19th of this month. And they will have a press conference, and we have NGOs Day. We have Jumat service. We have Thanksgiving service on Sunday. But on Monday, everybody in Akwa Ibom State is hereby invited to Ibom Hall, where we have dignitaries talking to each other on how to get rid of drug in our society, and how can we help in solving drug problem. In fact, you are highly invited.
All right, thank you very much. I know that it's an issue of public concern, and that's why we are seated here this morning to talk about it and to encourage those that are into drugs to stop it. We need to cleanse our society of drugs and also help those that have already been emerged in this kind of activity. But I want to say a very big thank you to you, Aweda Matthew, Deputy State Commander, NDLEA. Thank you so much for your time with us this morning. And of course, Barrister Clifford Thomas, State Coordinator, Legal Advocacy Response to Drug Initiative. Thank you so much for your time with us this morning. Anyway.